you have in this hospital, none of the patient would like to fall sick and got into that accident and, come and get the high-fi treatment from you. So the idea of this whole entire healthcare system of Pakistan is to stop people falling sick, to go for prevention. Like we have been hearing this whole thing since the childhood, that prevention is better than cure, prevention is better than cure. 68% people who are in the hospital, they are there, 68% patients are 68% diseases are the waterborne diseases. And that has been like, when I was the mayor of Karachi, I've been hearing this thing from the doctors, but never thought this way. Today, when I look at this whole thing, that means what? If you just take one single line, the 68% diseases are the waterborne diseases. That means if we provide as a state a clean drinking water to our people, so 68% of the burden of the hospitals will be reduced. 68%, huge burden. So how much we will save? How much miseries will be saved? But what's happening today? Are we putting any efforts on clean drinking water? No, that's not the case. A person or family or house or neighborhood, right? The first neighborhood of Pakistan, which is top on the mountain in Gilgit-Baltistan, when they flush their sewage button for the sewage in their houses, that sewage comes out from that neighborhood and it gets contaminated in someone else's water, the next door or next neighborhood, and their sewage water is going out without treatment and getting contaminated in someone else's water, and that's the case from Gilgit to Baltistan to all the way to Karachi. So entire country is drinking each other's sewage. There's no sewage treatment plant concept of treating and then throwing out their sewage, and yet we are calling 68% diseases are the waterborne diseases. So, and that doctors are not, ED are not supposed to go and put the sewage treatment plant in any neighborhood, or any health minister or professor and you doctors and all. The entire society's component needs to work together to synergize, to reduce the burden of the diseases, and that is what the healthcare system of Pakistan today. I always say it's not the health, it's a sick care system of Pakistan. We are waiting for the patients to come inside the PIMS hospitals and polyclinic hospitals and private hospitals and the government hospitals, and the kind of burden we are having is enormous. We can never have, no state, let's be very clear. I don't mince my word. I'm very clear about it, and I don't care who talks what. Would blame